Good afternoon, students. Yesterday we started with a new topic, that is, am I audible? Am I audible?
Yes, ma'am.
Okay. Yesterday we started with plan and construction of Kent's repertory. In while constructing his repertory, there are many repertories which are written by various authors, and they are arranged according to their plans, their styles, their philosophy. But Kant's repertory is the one which has been written according to Hahnemannian scheme. Hello, am I audible?
Yes, ma'am.
Okay. So this repertory was accepted universally because it was constructed very well, and we can able to find out the rubric with the help of Kent repertory very easily. Then in this repertory, as we discussed yesterday, that in this repertory, the construction, the plan, or the arrangement is from general to particular. So this in this repertory, it starts with section mind and ends on chapter or section generalities. In section mind, most of the rubrics related to mind, it was covered by Dr. Kent, and in generalities section, most of the physical modalities we found related to whole person we found in generalities section, and the rest of the chapters are based on anatomical division. There are about 37 sections or chapters which are arranged according to anatomical division of the body. Actually, there are 33 sections, but one section or one chapter, that is urinary organ, which is having 5 subsections, including urinary organ, that is urinary organs, bladder, kidney, prostate gland, urethra, and urine. In this way, there are 5 subsections. So, total number of sections or total number of chapters in this repertory are 37. So, while constructing this book, there are main 3 parts of this book. We discussed about that in yesterday's lecture, that is prefix part, repertory proper, and suffix part. In prefix part, the all the So the prefix part, it in prefix part, that is use of repertory, then how to study repertory by Dr. Kent, and how to use the repertory, it is also by Dr. Kent. It was given. Then repertorizing by Margaret Tyler and John Ware. Then we get the hot and group of hot and cold remedies, which was given, and this was given by Gibson Miller. So it is called as Gibson Miller's hot and cold remedies. Then few cases repertorized or worked out with the help of Kent repertory by Margaret Tyler and John Ware, it was given. Then the second part is repertory part. In that, it starts from mind, ends on generalities section. There are about 37 sections. The mental symptoms are given in mind section. Then particular section, organ or part of the body. It starts from section head and ends on section extremities. Then all general symptoms, that is symptoms related to sleep, chill, fever, perspiration and skin, these all came under physical general. So all these general symptoms we found under from under section sleep up to section skin, that is under generals the section sleep, after extremities section sleep, chill, fever, perspiration and skin, which are arranged. And lastly generalities section, in that aggravation, amelioration and general complaints and diseases it was given. Then the suffix part, in suffix part the this was not we found in original work, but in subsequent editions we found this suffix part. And in that sites of body and drug affinities by Boni Hussein, then relationship of remedies with duration of action by Gibson Miller, it was given. Then as we are discussing about the sections in this repertory, there are total 37 sections, including subsections of urinary organ. But these 37 sections was up to 6 editions of Kent repertory. Then after publishing 6th edition, Dr. Perez Smith, as we know, he go through he go word by word through this 6th edition, and he found many mistakes in the 6th edition. He corrected those mistakes and it was published as Final General Repertory. And in this Final General Repertory, he gave independent status to smell and voice. So, in 6th edition till 6th edition, there was smell and voice. They are not given as a separate section, but in the when Perez Smith corrected that 6th edition, which was published as Final General Repertory, in that we found independent status to smell and voice, making the number of total sections 39. But Jost Kunzli in Kent's Repertorium Generale put special senses under their respective organs, as special senses are given after that organ. For example, after eye, vision is given, after ear, hearing is given. So, in this way, special senses are given after the organ section. Afterwards, Dr. Jost Kunzli, he when go through the repertory, he included or he reduced the total number of chapters by putting the special senses under that part. For example, putting vision under eyes, hearing under ears. In this way, he reduce the number of sections. And as we found, there are 37 sections, but the total sections under group or group sections are only 30. And there are different anatomical parts which are given. For example, under that section, for example, under head section, different anatomical parts related to head, as for example forehead, occiput, temple, vertex, brain and meninges. All these are the parts of head, or all they came under section head because they are the parts of head. So in this way anatomical parts they came under one particular organ which are related to that part. So, as for example, under head, it contains the rubrics on all parts of the head, that is forehead, occiput, temple, vertex, brain, and meninges. Then under throat, it contains symptoms related or rubrics related to esophagus, pharynx, tonsils, and uvula. Then external throat. Under external throat, it contains rubrics pertaining to anterior neck such as goiter and glands. So under external throat, all the rubrics related to anterior part of neck, they came under external throat. Then chest, it contains rubrics on lungs, heart, aorta, sternum, mammary, axilla, diaphragm, and clavicle. So, under section chest, the rubrics related to all these things means the organs which are present in chest region. So, the rubrics related to those organs, there we found those rubrics under chest. For example, the rubrics related to lungs, heart, aorta, sternum, mammary, axilla, diaphragm, and clavicle. All the rubrics related to these parts we found under section or under chapter chest. Then under chapter back, we found the rubrics on cervical, dorsal, lumbar, sacral, coccyx, and spine. So, in this way, under section back, we found the rubrics related to almost all the spinal cord. For example, rubrics related on cervical, dorsal, lumbar, sacral, coccyx, and spine region. Then under abdomen, the section or under chapter abdomen, we found the rubrics on hypochondria, hypogastrium, iliac, ileum, inguinal region, then liver, spleen, and umbilicus. So in this way, under section abdomen, all the organs which are present in abdomen, the rubrics or the symptoms related to those organs we found under section abdomen. As for example, rubrics related to hypochondria or hypochondriac region, then hypogastrium, then iliac region, ileum, inguinal region, then liver, spleen, umbilicus. These rubrics we found under the rubrics related to these parts we found under section abdomen. Then under section or under chapter rectum, it contains rubric related to or rubrics on anus, then perineum. So under chapter rectum, we found the rubrics related to anus and perineum. In this repertory, systems are not given separately, but symptoms related to them are given under the parts. So, as the parts or as the body parts, body divisions, organs, they are arranged in anatomical division. So, how it was arranged, we see the order of arrangement of the different organs or different chapters, different parts of the body, how they are arranged according to anatomical division. We discuss one by one. So the first section is, which is the first section in Kent repertory, first chapter. Yes, which is the first chapter in Kent repertory? Anyone? In yesterday's lecture also I told, and just now I told which is the first section in Kent Repertory and which is the last section or chapter in Kent Repertory. Yes, which is the first chapter in Kent Repertory? Siddesh,
Mind.
very good. So, yeah, very good, Jagruti. So, mind is the first chapter in the Kent Repertory. After mind, there is vertigo, then head, then eye, then vision, ear, hearing, nose, face, mouth, teeth, throat. After throat, there is external throat section, then stomach, abdomen, rectum, stool, then urinary organs with its subdivisions, that is bladder, kidney, prostate gland, urethra, and urine. Then genitalia male, then genitalia female, then larynx and trachea, respiration, cough, expectoration, chest, back, extremities, sleep, then chill, fever, perspiration, skin, and last section is generalities. In this way, the sections are arranged according to anatomical division of body. Under each or under most of the parts, its function is given, or and we found the rubrics related to its function under those parts. For example, under after section I, there is vision. After ear, there is hearing. In this way, we found the symptoms, or we found the rubrics easily due to its arrangement. Then there is some particular arrangement of rubrics. Rubrics are also arranged in particular order. Am I audible? Am I audible?
Yes, ma'am.
Okay. So the rubrics, they are arranged from general to particulars. A rubric start with a general symptom with a list of large group of medicines. Means when we open the repertory and when we open any section, for example, we open the section head, then in head we found first the general symptom, for example head pain. So in section head we found the rubric, or we have the rubric pain. So under pain, the large number of, in front of pain, rubric pain, large number of group of medicines we found. So this was the general symptom or general rubric in the repertory. Then under pain, it was given first side, then time, then modalities and extension. So under pain rubric, then sides are given. In that, first right side, then left side. For example, pain, right side. So which medicines or which remedies which are indicated for right sided headache, they are given. Then the left side was given, that means the remedies which are indicated for left sided headache. Then the time was given, that means the Kent follows the logic of general to particular in this time also. Means first the daytime, then morning, forenoon, noon, afternoon, evening, twilight, night, midnight, after midnight. In this way, the time, is there any particular time of head, pain in head, then it was given, and the time was arranged as the sun rises and sun goes down. So in this way, first the general time related rubric is given, that is daytime, and in front of daytime all the rubrics related to pain in head at daytime they are given. Then morning, forenoon, noon, afternoon, as the sun rises the timings are given. Then afternoon, evening, twilight, night, midnight, after midnight. In this way, is there any symptoms related to time, particular time, then we found that symptom or that would be under in particular order in the repertoire. Then modalities. So modalities, which these include different factors which influence the symptoms and are arranged as elements from alternating with modifying factors, aggravation and amelioration, including concomitants before, during, and after. So, in this way, the modalities are also arranged in proper sequence. While arranging the modalities, there is also, he followed, Dr. Kane, he followed the proper sequence while arranging the modalities. In those modalities, first we found all the aggravating factors, and then we found all the ameliorating factors. And first in that we found the eliminating factors, then alternating with, then modifying factors, and after aggravation and amelioration, as well as concomitants before, during, and after the condition of the patient. For example, we are discussing about the head pain. So before, during, and after the pain in head, what are the modalities? What are the aggravating or ameliorating factors? They are given under time in proper or systematic way. Then extension. Extension part is mostly we found under section extremities, and this is the last subrubric and found mainly under pain. So most of the times the pain which move from one place to other place. For example, we are discussing about the pain in head. So the head, the pain in head which starts from right side, which is aggravated at morning after wake up from the bed, and it the pain increases in intensity as the sun rises. In afternoon there is maximum pain, and as the sun sets there is relief from the pain. The pain moves from right side to left side, or it goes from right to left side. So this is the extension, how the pain, this is all about the details about the symptom head pain. So how we found that rubrics, sub-rubrics related to pain in the repertory. So first we have to open the section head. Then in section head we have to find out the rubric pain. Under rubric pain, one by one we get the sub rubrics, sub rubrics. When we go through the repertory. Related sub-rubrics or sub-sub-rubrics we found related to site, time, modalities and extension in the repertory. So in this way, in Kent repertory we found the complete symptom and the extensions they are found especially under the rubric pain, because the pain symptom that is extend from most of the time from one part to other parts. So we found the rubric extension under the extension we found under rubric pain. A general rubric is followed again by subrubrics. So, as what is the general rubric in headache? So, the section is head, general rubric is pain, and under this general rubric or main rubric, we found many subrubrics. What are subrubrics? The they are related to that rubric, that is they are related to head pain, but in detail when we go while taking the history, when we ask the questions related to head pain, then we get the sub-rubrics related to that general rubric. So, the sub-rubrics we found related to site, time, modalities and extension. In this way, there is a specific sequence for arrangement of rubrics in this repertory. Is it clear how the plan and construction of Kent repertory? So in Kent repertory, I will revise once again. In Kent repertory, there are in this book there are mostly the three part: prefix, repertory proper, and suffix part. In prefix part, all introductory part is there. In repertory proper, there are 37 subsections which are arranged according to Hahnemannian scheme or according to anatomical division of the body. Then the third part is suffix part, in that sides of the body as well as relationship of remedy it was given. Then in repertory proper part there are 37 subsections. How they are arranged, we see the arrangement of those subsections sections, sorry, and they start from section mind and ends on section generalities. As he was or his philosophy, Dr. Kent's philosophy is based on deductive logic. He gave more importance to general symptoms and then he go towards the particular symptoms. So his repertory was also arranged according to his principle, according to his philosophy. And in his repertory, we found the first section is mind, that is related to mental general, and most of the physical generals, especially the general modalities we found in the section generalities, which is the last section in this repertory. Then there is some specific arrangement of rubrics in this repertory. All rubrics they are arranged alphabetically. The rubrics are arranged in on each page in two columns, and in front of rubrics there are group of remedies or indicated remedies they are given. Then general rubric is followed by sub-rubrics, sub-sub-rubrics. Then the rubrics are arranged from general to particular. Rubrics start with general symptom and state with a list of a large group of medicines. So the rubric start with general symptom, or in front of rubric a group of remedies which are indicated for that rubric they are given, and then he again gave detail about that symptom. Is there any modalities related to site, time, modality, and we found the rubrics related to site, time, modalities, and extensions after the general rubric, and which we called as subrubrics or sub-subrubrics. And while arranging these subrubrics or sub-subrubrics, we found that they are the rubrics which are given uh, while arranging the rubric, it is close to the margin line and it is printed in capitals of heavy block type. Then modification, the subrubrics, they are placed two places to the right of the margin line, means they are not given, the subrubrics, they are not given just below the rubric, but they are given below the rubric by leaving by placing two spaces to the right of the margin line, so that we can easily able to differentiate between rubric and subrubric and sub-subrubric. And the remedy line is four spaces to the right. Then the rubrics or sub-rubrics, they are arranged according to side, time, modalities, and extension. Only in chapter chill, the time is given as a separate rubric. So all these symptoms related to side, time, modalities, and extension, we found it under sub-rubrics, but only in chapter chill, time is given as a separate rubric. So uh, in this way, there is specific arrangement of rubrics, so that we can easily able to find out the rubrics or symptoms with the help of Kent repertory, and easily we can reach towards the simile.